is it called? The Freedom to Speak tours have you done?
Oh, that's a good question. We've done a few now. So we've done Christchurch twice, Auckland, I was going to say Whangarei, that's still scheduled. Done Palmy, Wellington. Did I mention Maru? So
no, you didn't. So you've been around.
Yeah. So probably I haven't actually counted them, but it's be close to a dozen.
Are we going? We're live? We're live. Well, there you go. Just like that. Thumbs up. We're live.
Yeah.
David Seymour, leader of the Act Party. Thank you for joining us.
Hey, thanks for having me on.
Thanks for being in Dunedin. We were talking about it beforehand, us boys kind of going, I wonder why leader of the Act Party is coming to see us. But you have done some strange things in your career for publicity, it would seem. Maybe not for publicity, but certainly that helped with publicity. And we thought maybe we were one of those little odd, idiosyncratic kind of events.
I think I've been very honest and authentic, and that's actually got some attention along the way. I mean, the video that I did when I first started campaigning, the high video that some people may remember, got about 50,000 views. It was just me introducing myself to the electorate.
Literally saying hi.
Yeah, like 5 times, hi. And we didn't set out to make something that would go viral or whatever, but it did because it was natural. So I don't know, but no, I mean, I come to Dunedin, at least a few times a year, probably every sort of 2 or 3 months on average. And it's a great town, and I've always got a good reception here.
Well, thanks for coming in. We did find this. We thought we'd share this with the punters as well. A lovely little video of you and Max Key that's got a fair amount of attention over the days. If we're lucky, it might pop up here. This was during your Dancing with the Stars performances.
I think it was a bit after it, but yeah, in any case, yeah.
I think you said in the end of it, this is how you vote for him. Have we got it, lads? Standing by. And tell me about that, Dancing with the Stars. Was it a good experience? Oh, here we go. Here's the sexiness showing itself as all in one go.
This looks like more like a How It Was Made version.
Yeah, I think this is behind the scenes.
I've never seen this.
Oh, haven't you?
No.
You got to say.
I didn't realise that. I didn't realise they'd publish it. That's amazing.
How much of this is? Because this is when Key was still Prime Minister.
No, he hadn't been.
Oh, okay. So this is just
PM for a while.
Oh, okay, it's 2018. Yeah, you're right. So you know Max because of the connection to John. Obviously, you worked with him.
No. I think John may have given Max my number, perhaps, but
regretfully,
he didn't do the introduction. Oh, look, I think basically the deal with Max was that I actually quite admire Max. I think that he gets put in this position he didn't choose.
Yeah.
And he's actually just had a lot of fun and probably capitalised a bit on being the Prime Minister's son. And that's one of the things about life, right? It's not the cards you get dealt, it's how you handle them.
Yeah.
So he got in touch, said, will you do this? And I actually said no a couple of times, but a little bit like you guys with your podcast, you're very persistent, kept asking, and I decided to go on. So, look, it was a bit of fun and it rated well. And I think anything that shows people that politicians are human is actually good for democracy. I don't think it's helpful when people feel increasingly alienated from the parliament, and you see that happening in the UK. There's a palpable sense that the people in the parliament don't represent the people outside the parliament.
There's a distance.
Yeah, and look, I don't think it's ever a bad thing to be able to have a laugh at yourself and actually, so I don't feel that I'm aloof or at a different level from other people in the community.
It's interesting though, as you were saying this, I was just thinking about Max Key came to prominence as the Prime Minister's son and then used that to do various things. Fair enough. I don't know anything about your family. Is that by choice? You keep all that stuff on the DL?
Yeah, I mean, look, my view is that, if New Zealand is very good in that generally they don't go after people for their private lives or their family or whatever, and I think that's a very civilized way to be.
Yeah.
It's not like American politics where everything's sort of in play, but I think there is a bit of a rule that if you use your family as a political tool, then it's fair game.
Yep.
So by and large, I've chosen not to do that.
Yeah.
I talk about my family sometimes, but I haven't, sort of rolled them out for photo ops or whatever, because I think as soon as you do that, people are saying, okay, you've presented yourself as this, and then, you got potentially people going to attack your family, or, if you have a family tragedy or whatever, then people could attack them for that. I mean, not that I have, but I don't want that extra dimension in my politics.
It's not just a political situation, though. It's a profile situation. I well remember, various celebrities wheeling out their newborn babies in various women's magazines. Yet then when they had a marriage breakup, they were like, leave my family alone. Well, actually, you've put your family into the public eye.
Yeah, exactly.
And even though it might seem a little bit icky, like the public want to know. And actually, if you hadn't have put them in the public eye, you would have had a leg to stand on to say, keep your distance. So no, I get that completely. Hey, it would be wrong of me on this incredibly interesting international political day with one of our lawmakers, our politicians, to not ask you about Donald Trump at the moment and see what you think is going on over there. Because today in particular, with the whistleblower papers coming out, it's a very interesting time. Got any thoughts around what's happening at the moment?
None whatsoever. About 2 years ago, I decided that everyone's got a limited amount of thinking space, and to try and follow the machinations of American politics, with Trump being what he is, and with the rather complex and convoluted system they have for checks and balances and impeachments and so on. I don't follow it closely. I'm interested in the policy implications of it, more at a macro level. How Trump is dealing with the relationship between the US and China, what his disposition is toward trade, because that really matters to New Zealand, what his disposition is on the role of America as kind of the world's policeman, which it has been for a long time, which New Zealand frankly has benefited from. So I'm interested in those issues, but so far as like who said what in the last 24 hours, I mean, you can either spend your whole life trying to keep up with that, or you do other things.
It's always looking at the American system and looking at how it works. It seems that what they consider right wing, the GOP, most countries would consider kind of further right than just right. Like if you line up our politics against their politics, I always used to remember talking to my American political friends and watching their heads explode when I talked about things like our quote unquote right wing prime minister supported things like working for families and interest-free student loans and these sorts of things, which some in America think are a far left ideal.
Well, I think it's really interesting to actually line up objectively where New Zealand and the United States are on a range of policy positions, because people tend to get into caricatures of countries. The Scandinavians are socialist. Well, in many respects, they're very market-oriented countries. America's right wing, well, actually, in many respects, they are way to the left of us. And I would argue that by and large,
like what? What aspects?
Trade and agricultural subsidies. They basically put heavy tariffs on importing things that could be very good for the American consumer, but that's heavily tariffed. They subsidise a lot of very inefficient farm producers, and that's, I think, one of the reasons why the quality of food in the United States is actually very low. The volume's high, but they basically get a lot of low-quality subsidised stuff. Take a look at tax rates. Their tax rates in many states, if you add together your federal, then your state, and in some cases even city income taxes, you could be paying over 50%. So if you talk to your American friends and say the highest income tax rate in New Zealand is 33 cents, there's no basic personal exemption, and we generally don't have any of the avoidance and stuff that you guys have. I think they'd say, whoa, you guys are very much to the right, quote unquote, of where we are.
But if you then did the same thing and included things like GST, et cetera, et cetera, et cetera, obviously a real world application is going to be more than 33%.
No, because the way to really judge it is what is government expenditure at all levels of government as a percentage of GDP. So in New Zealand that's about 40. I think in the States it's maybe in the mid to high 30s. So in terms of the overall level of government expenditure, we're a bit higher, but not much, nothing substantial. And then you look at what you get for it. So the big difference is that we have a universal health insurance single payer system. They don't have that. But even then, people forget Medicare and Medicaid, one for the poorer Americans, one for the older Americans, those two public healthcare systems, are incredibly generous, even by New Zealand standards. So, there's a lot of caricatures about the US. I would say that New Zealand ranks more on the free market end of things. And actually, the free market think tanks of the world, the Heritage Foundation and the Fraser Institute, who do league tables of how free market a country is, consistently put New Zealand in the top 3, and the US is seldom in the top 10 these days. So we are much in terms of free markets, we're way to the right of the US.
I've asked this exact question of both David Clark and Marama Davidson. I'd like to ask it of you as well, being someone in a different part of the political spectrum. Can you explain to our American friends, if they were listening, how we managed to do a quote-unquote free public health care, and many in the American political system could say we can't? We can't. They would say we can't afford it. How do we manage to do it and they can't?
Well, I mean, they could do it. But there would be a lot of political resistance because of the fact that, from their point of view, our system is really quite strange. I've, for various reasons in the last few years, had to visit a few friends in hospital, and you think about it, you walk in there, anyone can walk in and out, nobody really owns it, there's no contract, there's no payment, you just kind of get what you're given, and I've been in there for a few reasons. Some of those people I call friends are really, well, they have become friends, but they're really constituents that I've been trying to help when they've been underserved. And really the only way that they can get stuff back is politicised. So I can understand why for them they say, okay, the state's going to take your money and in a very sort of, I guess, oblique way, we will give you back some sort of health care, but don't try and pin us down on exactly what. So I understand their resistance. The other thing I'd say is that, a lot of people, and I experienced this when I lived in Canada, they say there's two kinds of healthcare in the world. There's what the Americans have and what we have. Well, actually, there's quite a wide range of systems. So if you look at the French, who at various times have been rated as having the best healthcare in the world, they have a mixture of public and private where it's mandatory to have insurance. Everybody has private insurance. If you have low income, the government subsidises your private insurance scheme. And if you get sick and have to go to a hospital, there's probably about an even chance that it'll be a private hospital or a public hospital. So I think we need to stop thinking about, the Americans are all bad and free market, because they're not. And that's another story we can talk about, why the American system is filled with state-sponsored bureaucracy. And our system's somehow better, because it's not. It's actually quite terrible in a lot of respects. And then start saying, well, actually, there's other options. How do they do it in Japan? How do they do it in France? How they do it in Singapore?
How do you
there's
think,
many models.
If you're looking at all these models, out of interest, how do you think we might improve our system? Would you like to see everyone's insured and then there's help for those who can't afford it? Because I guess the way I look at it, and I want to get onto euthanasia with you shortly. My mum passed away 11 months ago from motor neuron disease.
I'm sorry to hear that.
Yeah, thank you. The best of the public health system. I saw the best of it, right? Not saying that those stories about the person with cancer having to go to Sydney for treatment is not true and accurate, but I saw the best of it. And I think that what I've seen of the system, how so we had an accident using a wood cutter splitter the other day, straight to A&E, no bills. I have an issue with my eye duct being blocked. I have health insurance, so I'm going that path. It's like having the option seems to be, it seems to the American model, a lot of people seem to be saying, whether they're true or not, it's all or nothing. It's either all private healthcare or it's all public healthcare. We have a system where we can pick, and then after we pick, we can still use both systems.
Yeah. Well, I mean, let's just do a quick rehearsal of what's wrong with the American system. People say, well, okay, look, I'll answer your question first. Look, one of the reasons the New Zealand system has a lot of support is that overwhelmingly people go to the New Zealand healthcare system and they see first-rate doctors, nurses and other allied health professionals that are really intrinsically motivated and do a great job. And, it continues to enjoy a lot of public support, even though often the morale within the system is quite low because of the way it's managed. So, there's no question that most people have a positive experience, and it's not a major political issue because of that. The other thing I'd say is that, you asked what sort of model for New Zealand. It is a lot more difficult than just taking a model like, say, France's and planting it here.
Of course.
And the reason for that is that, Paris, for example, is a city of 12 million people, so they can have a real marketplace with many insurers, many providers, and it kind of works, right? On the west coast of the South Island, even in a place here like Otago, which is a relatively large population centre, but by global standards, there's not enough to have most of the specialists at a high level in a hospital, let alone 2 competing hospitals. So the design of the system in New Zealand is harder. I do think that it would be good to have more separation between the purchaser of the service and the provider, because often there's people who want to provide, lab testing and so on, and they're providing it to a DHB, which has its own provision arrangements. So when it comes to providing or getting some sort of competition and efficiency, there's good reasons why that hasn't come along as well as it might have. Because this purchaser-provider split is gone. It's also a problem, in my view, that you've got 20. I always forget if it's 28 or 21 DHBs. In any case, it's an absurdly high number for the number of people being served in this country. So, look, I think fewer DHBs, fewer purchasers, and a split between those who purchase and commission the services, those who provide them, would be helpful. Basically, that is what New Zealand had in the 90s. But it fell down in large part because people were unwilling to accept that the purchaser would say, we just aren't going to cover some services some people want.
Right.
Far easier for a DHB to say, look, we'll get to you, and whether they ever do doesn't matter so much. They don't explicitly make the statement. But I mean, just to rehearse the Americans, I'm not going to go on too much, but look, first of all, most people have no idea what their health insurance costs. Why? Because it's paid by their employer. Why? Because of tax exemptions. Why? Because during World War II they had price controls or wage restrictions, and so employers started offering tax-exempt health care and insurance as a way to compete for workers. You can't get health insurance that competes across state lines. Why? I have no idea. There are many states which are effectively a monopoly, where there are mandatory minimum numbers of things to be insured. So, for instance, in some states, health insurance has to cover reading glasses. Guess what happens in those states? People replace their reading glasses, if I remember rightly, 6 times more often. It's sort of like having car insurance that includes car washes. Of course, everyone's going to, so people wonder why it's more expensive. And then you've got their tort laws, which are just completely crazy, where, it's amazing anyone still operates or gives medical advice in the States, because you get your ass sued and lose everything. So, there's a bunch of reasons why healthcare in the US is very expensive for the outcomes that they get, and there's reasons why a lot of poorer people can't access it. But most of those reasons are actually caused by government-imposed bureaucracy. And I think the problem with Obama's reforms is that he tried to fix the supply side and force everybody to buy insurance. The problem was no one could afford it because for reasons that were just outlined. Anyway.
Would it be fair to say that one of the themes of ACT, maybe one of the themes of the parties that are on the right, do you mind that, being kind of identified as the right side of politics? Is that something that doesn't resonate with you? Look,
I think it's a bit defunct because how do people understand a party that wants low taxes, wants personal responsibility, but also eschews what I view as, frankly, the moral bigotry of being, anti-abortion and anti-assisted dying and really trying to impose, a sort of social straitjacket on people. So, right doesn't really allow you to capture that. But I'm not going to get hung up on it.
And I don't want to pigeonhole you either. So rather than using those terms, I'll just say ACT, and we're one of the. I've interviewed Rodney Hyde probably 10 times. I used to enjoy interviewing him. And smaller government. You mentioned fewer DHBs, for example, seems to be a common theme. I've always wanted to understand that, because I don't think smaller government is better. I don't think bigger government is better. I think better government is better. Now, in some stages, we probably do need reductions, and in other places, we probably need expansions on areas within government. Do you do you think smaller is always better? Because, as I say, that is a traditional position of a political party in the position where ACT is in.
Well, you can always find examples of where government should be actually doing more. I mean, one of them is, the welfare state is really a social insurance scheme. Your taxes are your premiums, your payout is when something goes wrong. I think there are people with disabilities who actually get a really shoddy payout. And the question is, how can you differentiate people who, really through no fault of their own could do with a bit more from people who are just taking the piss? And that's really quite difficult to do because, once you make the criteria wider or the payments more generous, there are always going to be people that come along and try to take advantage, and that's a shame. But there's one area. The other really obvious answer, as an Aucklander, I would say it's just embarrassing to look at the motorway network that was laid out in blueprint in the 1950s and what's actually been built. I mean, only about probably less than half of it is actually there. And
Mayor Robbie, he had a good plan.
Well, I mean, I'm not that good at the exact history of the mayors, but certainly I've seen the 1950s blueprints. We've had 60 years to build half of it. It's outrageous. And of course, the flow-on effects of that is that, can the average person who does everything right, who, goes to school, does their homework, gets some sort of qualification, gets a job and earns an okay salary, can they afford a house of their own? Well, they can't. Why? It's not that there's a shortage of land. There's a shortage of infrastructure to connect land with opportunity, by which I mean jobs and education. So, that's an area where I think government hasn't done enough. And so, there's you can be a free marketeer and still say, well, I think, disabled people should be looked after better, and the Auckland motorway network should be completed. And you can make the same arguments for the South Island. I mean, you make the same argument for rural New Zealand.
Oh, there you go. It's probably the 50s one that the boys have just bought up.
Oh, there you go. Yeah. So I mean, you've got basically a loop. A ring road. You've got a ring road. I think you should have 3. If it's the right one, you should have 3 harbour crossings, although they don't seem to have gone across the north there. So you start to get the idea. East Auckland, there's a lot better connected. That's never been built.
But it sounds like what you're saying, and what we do with this thing normally is have relaxed and laid back conversations. We're being a bit more kind of question because you do have a tight finish of 4 o'clock.
Okay.
So it sounds like kind of what you're saying is it's not about bigger or smaller, it's about better. I mean, you agree with that? Because there is often that smaller is better, but better is better. Yeah,
but I mean, I've just come up with 2 examples of where government could do more.
Yeah.
Look, I would say that the way that the middle class has been sold the promise of the cap and gown photo for every kid over the last 30 years.
Yeah.
The price controls, the increased subsidies have actually ruined the value of university education. I think that is a real travesty. I think that the way that the Ministry of Education tries to centrally control what schools you can go to, who can open up a school, how they're funded, what sort of employment contracts the teachers can be on, that has really killed so much innovation that could help kids a lot more. And we saw that innovation for a brief flicker when we allowed charter schools. So there's big government. As I've said, I think the healthcare system is overzealously regulated from the centre and has too much of a regional bureaucracy as well. I think that a lot of the middle class welfare, working for families, pensions at 65. We've talked about interest-free student loans and fees-free. These are not things that are done because you could seriously win the argument in front of a panel of disinterested observers. They're done because they appealed to the voters a particular government needed at a particular time.
There's no question that some policy is based on populism.
The Resource Management Acts, and the way that instead of asking the question, is this person using their property in a way that harms the property of others, i.e. a property rights approach, instead says councils have to create master plans for whole regions, and then everyone has to ask permission within the rubric of that master plan to do anything with their own property. Put housing out of reach for a lot of people. It's been bad for the development of a lot of the rural and agricultural sector, but also it's been terrible for the environment. So that's an area where I think we've been overzealous as regulators. And you just look at this current government. I mean, I'm going to start calling them the Taliban. Look, plastic bags, banned. Offshore oil and gas exploration, banned. Vape juice, about to be banned. Speech, and risk of being banned. AR-15s, centre banned. They're just constantly banning things.
Yeah. So let's look at the vape one, for example. What's your thoughts on that? What do you think should be happening with the vaping? I noticed the other day, actually, as I was going through a supermarket, that all the vaping product was out on display. But of course, all the cigarettes are hidden away, and I was wondering what's the difference. I actually phoned the Labour Department, if that's what they're still called, MBIE, whatever it is.
Yeah, well, the Department of Labour is within MBIE.
Yeah, and because what I wanted to know was, I have guests that come along, and are you allowed to vape in a workplace? You can't smoke in a workplace, but are you able to vape in a workplace? And they told me it's exactly the same as smoking. But I'm like, well, it's not, because I can see it on the shelf.
It's not regulated as a tobacco product.
So what is it? I mean, so
yeah, I don't know.
You talked about personal responsibility as well. Where does the line of personal responsibility come in? And I don't know if it was today, but either ACT. When I say either ACT or yourself, I guess you kind of are ACT.
Well, no,
but you've made a statement about the 10% increase on tobacco, for example, being pointless. And there was an article from 2018 where you guys wanted a 75% reduction in tax on tobacco. There it is there.
Yeah, and look, I think that's actually the right thing to do.
Why?
Because, first of all, you got to ask three questions. Well, let me say again. You got to ask three questions about any policy. What's the intent? How effective has it been? And what's the side effects?
Yeah.
Well, the intention presumably was to reduce smoking rates.
Yeah.
The effectiveness is that smoking rates actually went down faster for the 5 years before the policy was introduced than the first 5 years of rolling 10% increases. And what are the side effects? Well, the government now takes $2 billion a year, mainly out of the poorest households in New Zealand. Getting rid of that tax on nicotine is one of the most profound poverty reduction processes that the government could possibly go through.
So what do we do? If the tax is not going to work, I mean, you would agree that smoking is bad?
Yeah, I mean, look, I think
a bad health system.
I think it's bad.
Are you a smoker?
No,
Have you been a smoker?
No. I mean, I think it's bad, but the question is not whether I think it's bad. I think lime milkshakes are bad.
Yeah,
that's different from my political position. And my political position is, look, if people want to do it, then fine. It's not the end of the world. I think it's ultimately a bad choice for your life, but it's not the end of the world.
So that feels a bit libertarian.
Yeah. Well, look, who am I to say that, I don't really know you. I don't know if you smoke. I don't know what your aspirations are or your position. Who am I to say whether or not you should smoke or not? I can tell you all the statistics and the facts, and there's a chance it'll kill you, and heart disease, and all the rest. I mean, I get it. I can tell you all that. But honestly, as a politician sitting here right now, can I tell you if it's really in your best interest or not? I don't know enough about you.
Well, I think I think when you say things like lime milkshakes, you can make that argument, but smoking is bad for you.
You tried a lime milkshake, you're an idiot.
I mean, when I was in my 20s and stuff, I enjoyed the odd cigarette with a beer and stuff. I mean, I'm sure most of it are the same. I mean, are you a smoker now?
No. I have been in the past.
Yeah, well, so we've all done it in the past. We've all figured out a way to get over it. But surely you sitting there saying, I can't tell you whether it'll be good or bad for you about smoking. You can say if smoking will be good or bad for you.
Well, no, because it depends on what your overall aspirations are.
Like if I want to die 15 years early.
No, you might not want to do that, but you might decide that you get something out of it that is worth the risk, and that's your personal values. Okay. It's not up for me because you think about it. For me to answer the question of whether you should smoke or not, I have to know what's important to you.
Yeah, okay, fair enough.
And I don't know what's important to you, and just think about it for a moment. Wouldn't it be weird if I did?
Yeah, I actually accept what you're saying is fair enough, but I accept it as fair enough if it's consistent as well. So in other words, surely you must support things like, and I'll use silly things like helmets on motorbikes. You shouldn't worry about that if it's my choice. If I get more enjoyment about having the wind in my hair than the safety of the helmet, ACT would support that. Well, what about things like cannabis, heroin, that kind of stuff? You're not going to sit there and say it's bad for me if it's. If my choices imply
there's a different argument if there are spillover effects on other people.
Sure.
So the example of the helmet on the motorbike.
Yep.
I guess really the question is, are you prepared to pay the price of that risk? And it's not
That's
actually
the same as smoking. There is a price to that as well.
Yeah, and so
it might be a 40-year price rather than a 40-second price.
Well, I'm talking about the cost to others mainly through the health system. So, the interesting thing is that because smokers tend to die earlier, they collect less super.
Yeah.
But they still pay quite a lot of tax in the meantime. And, I mean, they do cost a little bit more to the healthcare system, but not much, because everyone's got to die of something.
Right.
Smokers aren't necessarily more expensive. And then they pay a huge amount of excise tax on nicotine. So, when you put it all together, smokers are like fiscal heroes to the nation. Like, we couldn't do without them.
It sounds like what you're saying is, if you can afford to make bad decisions, that's fine. If you can't afford to make bad decisions, then it's okay for us to regulate.
Well, there's to a certain extent that's always going to be true. I mean, if you have more money, you have more choices. Yeah. That's absolutely. Try buying a car. Try going dining tonight. Whatever you do, if you have more money, you have more choices. That's not something I've invented. That's just the way the world's been for a long time.
We're going to skip through a couple of other things as well, because I do want to talk to you about the euthanasia bill.
Yeah.
One of the things I want to talk to you about, as I said, 11 months ago, my mum passed away, motor neuron disease. I understand from a family member, she'd said to them like a week before she died, if I could jump off a bridge, I would have. That's one story from one family member who's told me about that conversation. I thought I'd get to the end of her passing and be really clear, and I got to the end of her passing and it made me more confused about euthanasia, because we had experiences, and we actually had it was purely by chance, but the first podcast I did after she passed was with a academic from the university here, whose one of her areas of specialties was end of life decisions, and she's a bioethicist called Janine Winters. And I realized that there's more than just the person involved in this decision. I got to spend the last 24 hours with my mum. I got to sit there after she'd passed for an hour and a half, just me and her in the room, waiting for her body to be taken. I didn't want to leave her, but I found that to be really special. When we were speaking with Dr. Winters, now this is what I want to ask you, because this changes, your bill may have changed and these things may not be a part of it. She said one of her concerns was actually the autonomy of the patient to be able to make the decision for themselves with no consultation with, for example, family members. That someone could actually say, I'm done, I want out, tell the doctor that, and that's decision made. Now, I understand that we want to be responsible for our own actions, but there is other people involved in this person's life to be a part of this decision-making process. Is that still a part of the bill? Is that being tweaked? Because I know there has been changes of recent times.
So the bill requires the doctor to encourage a person to discuss with friends, family members, counsellors and so on, but also tells them that they're not strictly required to.
Right.
And that's really important for a couple of reasons. One is that, there might be a person that the patient really doesn't want to talk to, who could be a very negative influence. And the idea that we would pass a law that forced people to talk to them, well, that would actually be doing some harm. So that's the first thing. The second is that if you think about it, medical privacy has been around for a long time. People make decisions every day that have life or death implications. Sign do not resuscitate, decide whether or not to be operated on, decide whether to continue a certain treatment or start a new treatment. I mean, these decisions every day, probably I suspect thousands of such decisions are made in New Zealand. And of course, the gist is that privacy trumps all. Now, some people say, I don't want my family member to be able to make that decision without consulting me. Well, actually, they can already make lots of decisions. And frankly, if you need Parliament to pass a law to make your family talk to you, maybe it's time to start being a better family member.
True. The other thing, and I jotted it down just to make sure I wouldn't get it wrong. At that time, remember this is October, November of last year. It may have changed. That her she wasn't a pro-life campaigner. She was a doctor who she talked about the Oregon model where they give out a pill, and that was so she was in favor of that. So this is not coming from a doctor who was anti the idea. She said the capacity for a person to make a decision and the concerns about coercion. And she said then both of those are decided by the doctor. And she says doctors are not trained to make those decisions. And that was another concern of hers in the bill. Be interested to get your take on that now.
Yeah, so a couple of things there. First of all, it's 2 doctors, and if they have any uncertainty, then either of them can say, look, not sure about this one, we're going upstairs, by which in practice means the bill requires they refer them to a psychiatrist. So
why don't you just include that from the start?
Well, because actually, I think when she says doctors are not trained to make this decision, I mean, come on. Every day, doctors have to help patients make decisions about a whole range of treatment options, as I discussed a moment ago. The idea that doctors have no idea whether the patient's actually competent and able to make the decision and being coerced, and they just go ahead anyway.
Well, that's not plausible. I think that it's probably plausible, in my opinion, for the capacity thing. You can see that, but the coercion thing, no, I don't. What you're saying is, as a medical doctor, specifically, that she did mention both of them. But how does that? Without the training to be able to still know that, that's something that she thought shouldn't be put on the medical fraternity.
Yeah, and there'll be a range of views within the medical profession. Of course, doctors don't have to do this.
Yeah, that's the other thing I was going to ask.
And if they can opt out, and some doctors will, and they will be those who understand that they have a duty to find out if a person's competent and stop if there's any reason to suspect that they're coerced. So there may be some doctors who don't feel they're capable. I know ophthalmologists who don't do heart surgery. That's every doctor has a sense of what their specialties are. But on the coercion issue generally, this is one of the arguments that, not that your friend the doctor is necessarily an opponent, or you are, but the opponents have zeroed in on this because they've said, what if there's undetectable coercion? And it reminds me of a time I was at a British airport, and this airport security staffer said to me, has anybody put anything in your bag without your knowledge? And
how would you know?
Well, yeah.
Exactly.
So it's a great argument, right? Because it's the easiest thing in the world to claim and impossible to disprove. Well, actually, we have figured out how to disprove it, because if assisted dying around the world was premised on coercion, that weaker, more vulnerable people were being pushed into it, then it would show up in the data in the following way. You would see a spike in the number of people who perhaps didn't have good health insurance, didn't have good access to palliative care, people who had psychological traits of being more agreeable, people who weren't so educated, would be people that would be sort of more likely to show up. And the interesting thing is, this has been studied at some length, and the opposite is true. This is something where generally you have to fight through the bureaucracy to get it. And so, people that access assisted dying in countries like the Netherlands and Oregon typically are more educated, have more access to palliative care, interestingly, more access to health insurance, generally more assertive people who are more used to getting their way, frankly. And when you look at the rigmarole you have to go through to get it, that's not entirely surprising. So, yeah, if I thought there was a coercion issue as a libertarian, I wouldn't be supporting this, because, if I believe in not harming other people, the last thing I want is a regime where you can be involuntarily killed. But we've been around and around this mulberry bush, and there is no evidence of that happening. In fact, it's the opposite.
We've got about another 10 minutes or so we will move on. As I say, next time you come back, and I'm sure there'll be.
So far, so good.
I'm sure there'll be. All the leaders will come and see us next year, Jace, for a particular reason. Let's talk about the freedom to speak. The freedom to speak tour. What are we losing when it comes to? I don't feel any restrictions on me about speech at the moment, but maybe I'm just a big dumb idiot who doesn't know what's going on. What's it all about? What are we losing?
Well, I think first of all you're right that freedom of speech in New Zealand's been very well protected to date, and that is something that we should really jealously guard. I think what's happened in the last 6 months with the government promising to take a largely defunct part of the Human Rights Act, Section 61, that hasn't been used successfully in court since 1979, when it was actually part of a different act at that point. Anyway, the idea they're going to take that They're going to strengthen it up somehow. They haven't said how, but make it more likely that there'll be successful prosecutions for people
for
saying
things such as,
well, for things that this is the problem, right? It's going to be things that we don't know exactly what people will be prosecuted for, but it will be things that I can tell you one thing about will be politically unpopular in the times of the day.
Are they going to be what we see in things like Canada with Jordan Peterson? Are those the kind of concerns?
I think a really good example, talking in Dunedin right now, would be what has just happened to Professor James Flynn's application to have a book published by a private publishing company. I don't know if you followed this story, but the long and short of it, James Flynn is a terrible lefty.
Yeah.
He's been a candidate multiple times for the now thankfully defunct Alliance Party.
Right.
He's also one of the most prominent academics New Zealand's ever produced. The Flynn effect, the idea that each generation scores higher on IQ tests than its predecessor, is named after him, and very few New Zealand academics have a globally recognised scientific term named after them. He's written a book which is basically making the case for free speech on university campuses.
Yeah.
The great irony is that the publisher wrote back to him and said, we're scared to publish it because the UK laws are opposed to stirring up resentment along a whole lot of demographic lines. So you can draw a straight line from the laws the British Parliament made in the Public Order Act 1986, and they've amended it and added to it progressively over the years. And a top-class academic who's not of the hard right, he's of the absolute opposite, being refused publication of a book about freedom of speech.
Yeah.
And so what I've said is we got it pretty good in New Zealand. If the government is going to make a proposal to upgrade Section 61 that you've got there,
Yep.
I'm going to put up a private member's bill which proposes to remove such sections completely, because if they haven't been used since 1979, they're not doing much good, and I would rather affirm that New Zealanders have a right to freedom of expression than risk getting into a debate on the back foot.
So is this more, I'm just looking at your on your website, your Facebook page, about the event in Christchurch, and it says, we live in a time of fearful conformity where people feel afraid to say what they really think. I don't know whether you put that up or that was the person.
Yeah, no, I wrote that. Yeah,
okay.
I think that's true.
Again, forgive me if I'm being naive. It feels a bit like the right in America saying, there's a war on Christmas. There's a war on Christmas. Whilst in Central Park, there's the world's largest Christmas tree.
Yeah.
So I'd like to actually understand
it. That's an unkind comparison. Let me tell you. Let me tell you where that came from.
Yeah.
I was talking to somebody a few weeks ago who works in market research, and they watch people, doing focus groups.
Yep.
And they said, look, it's been really noticeable in the last few years. The climate has changed, and you watch how people feel each other out to try and work out what the acceptable thing to say is.
Sort of in the group, they can see this happening.
Yep. So they're actually seeking approval. They're seeking what is, what are the things you're allowed to say and what are the things you're not allowed to say.
Yep.
And I think that is something that's not just a one-off. Obviously, this person is an interesting person to talk to about it because they see a large range of randomly selected people and they're a professional. But then you go to anecdotally, a lot of people, message me and say, I feel like I can get in trouble for expressing my views. A lot of students on campus feel that there's an endorsed view on a range of issues. Sure. And if they feel differently, then they're going to be in a certain amount of trouble. I'm just trying to think who asked me about this.
Well, actually, I also guess you would get those messages because, that seems to be something happening on universities over the world, that they say the universities are becoming a bastion of the far left. So if you have a conservative or a non-far left position, that you're fearful. And I guess from you being in the ACT position of the political spectrum, which we will not mention how it's sometimes referred to, it would be more likely for you to receive those things. For example, I don't want to. I'm not into pigeonholing. Yeah. So I don't like that. Yeah. I think identifying you as a libertarian is a really interesting way because maybe not all ACT members have always been libertarian. So that brings some clarity to perhaps your positions on things. So what I'm saying is you're more likely to hear from those people being where you are politically.
Yeah, well. I suspect that there's a bit of a sampling effect there, and that's probably true.
I guess I'm just trying to figure out what are people fearful to say and talk about, because I don't experience that. Maybe it's because I'm an ex-talkback host who's opinionated, arrogant, and has a mouth that goes faster than his brain. I don't know.
Yeah, and if you want to get into sample selection, in a way, you will probably be the last person to realise this is happening. And it's not just because of the kind of vocation and personality that you have. It's obviously done really well for you in this role, but you're not someone that sort of seeks approval for your views often.
Well, but in saying that, we all seek approval on some level. I mean, you seek approval amongst your constituents in Epsom because that includes a vote.
Yep.
I seek approval amongst people listening or watching this podcast because I want more people doing it. So on some level, we all do.
Yeah, we do, but not generally for having your own thoughts.
Yeah.
That's the thing people are worried about.
Is there anything you're afraid to talk about? Like, is there something right now that if I brought up, you'd go, oh, no, I'm not talking about that? Like, do you feel hamstrung?
Yeah, look, I'll give you an example. I was on a panel about 3 weeks ago, and the panel consisted of an academic from Massey, which I wasn't sure was possible, but anyway, that's what he claimed to be. No, Massey's a good place. I have good friends into Massey. And then Tracy Watkin, who edits the Herald, not the Herald, the Sunday Star, the competition to the Herald on Sunday. The question came up of should the Christchurch terrorists manifesto have been censored. Now, I had taken the position for a long time it shouldn't have, because I read it, funnily enough, because I was on lockdown at the University of Canterbury at the time, and I was with a bunch of students who were sort of crapping ourselves, and we were reading everything to try and figure out what's going on.
So you got it immediately?
Well, we found it, yeah. And I think it's a piece of crap, really. But I also know that now that it's been forced totally underground, there'll be kids reading it in their parents' basement, and that really, really scares me.
So you're about the best disinfectant is sunlight.
Yeah, but the point of the story. Sorry, I've gone on a bit, but I had never said that before, and I was never going to say it because I don't want in any way to be seen as endorsing the guy. And some people will inevitably hear, if I think people should read it. I don't think people should read it. I think some people should read it so there can be some decent critiques. So
it sounds like you're not worried about saying stuff. You're worried about how it gets interpreted.
No. The point is, I only am saying that now,
right?
Because Tracy Watkin and this Massey academic guy were on the panel, and it was when you're on a panel of three, usually it goes in order, and they both said, look, it's ridiculous. It shouldn't have been censored. And because they'd said it, I said, well, actually, I have not said that for the last 6 months, but I think they're right, and I'm glad they said it. So, yeah, I mean, there's an example of where, I'm a bit like you in a sense that I'm used to getting a lot of criticism, and I'm probably not so fearful of saying things. But there's certainly a climate, in my view, where we're not very good at doing civil disagreement. And as a result, people really think hard before they say something, even if they think it, because they're worried that rather than people saying, okay, you think that, I disagree, it's fine, the world goes on, you're going to get a Twitter pile on, or, you're going to get people attacking your place of work. You're going to end up being ostracized by your class at school or whatever. And a lot of people have that fear these days, and I think that is a real problem.
Well, look, on that note, it is 1 minute to 4, and I know you've got a call coming at 4:05 that you need to be available for. So rather than going in and saying, I'll say it anyway, I agree with you about the Rugby World Cup, that the government should get their nose out of it. And it really irks me when people say things like, oh, it's my right to see the rugby, it's a national right. No, I always say to people, so before there was television, when there was a game at Eden Park or wherever, Athletics Stadium, whatever it was, did you have to pay to get in? And they'd say yes. And so you had no right to see the All Blacks for free then. Exactly. So you've got no right to see the All Blacks for free today.
Yeah, and
so I agree with you.
And look, they can say an infinite number of people can watch it, but a limited number of people can be at Eden Park. But what I would say to people is, if you have a right, somebody somewhere has a duty, because a right is meaningless unless someone else has a duty to fulfill it.
Right.
And if I've got a right to watch the All Blacks on TV, then who on earth has a duty to make sure that there is a game of rugby and there is an All Black team and they've got someone to play and it gets broadcast and sent back here. That's a lot of duties on a lot of other people.
Because what happens next year if there's no All Blacks?
Yeah, and I've done nothing for that. I mean, those people, they probably expect the All Blacks to win every game too.
That's my right. That they win the World Cup.
Yeah, well, exactly. And I always say to people who talk about rights, I say that's great, but who's got the duty to fulfil it?
All right. So obviously you think the All Blacks are going to win the World Cup. Last question, 10 seconds. If not the All Blacks, who?
Look, I'd look out for one of those Celtic nations. I think the Irish, and I know they're not Celtic, but the Welsh, they've been coming up, and I think it'd be kind of cool if one of them won it.
I'd like to see All Blacks Ireland in the final.
And the game needs to be diversified. It can't just be England, France, New Zealand, South Africa, Australia. There's got to be. I'd love to see, if it's not the All Blacks, I hope it's someone new.
Yeah. All right. David Seymour, leader of ACT, thank you for coming in.
Hey, thank you.
And we will hopefully see you again, and we'll crack a beer and go for another half hour.
Yeah, great. All right. Catch you soon.
All the best.
Oh, it was great. Cheers.